Hello everyone, look who we have here at the practice. It's Dr. Ojo-carons. He is a renowned urologist, surgeon, and chief financial officer at Hello Climax. It's lovely to have you here, Dr. Ojo.
Thank you, Halima. Thank you for having me. This is such a pleasure, delight to come here and see your practice and help promote the practice. I'm very excited, and I know you have a lot of questions for me.
Yes, I do. So we're going to do something fun today.
Okay.
We're doing 6 questions in 60 seconds.
Wow, okay.
Are you ready?
I'm ready, I'm ready.
Okay, so we're about to start.
I think I'm ready for it.
Okay, let's do this. Sorry, I want to get the timer.
She's trying to time me. Oh boy, it's a lot of pressure.
Don't worry, it's fine.
Okay.
It's safe. Okay, so we're about to start. 3, 2, 1.
Okay.
Go. So tell us about yourself.
So my name is Dr Ojo-carons. I Yoruba, born here in trained in Lagos, and then traveled abroad. So I practice and I live in Virginia Beach, US. I practice general urology and female reconstructive urology, and I wear a lot of hats. And so my wife and I partner, and we have an aesthetic practice called Climax Aesthetic Practice. And so that's how we got involved and connected with Flawless Hair by Abby.
Yes, that's amazing. Second question, what does being a urologist mean?
Being a urologist is very wide. I call it glorified plumbing, but there's a lot of things around that. So essentially we deal with anything from the kidneys and the drainage down, the kidneys, the ureter, the bladder, the vagina, the reconstruction, and then also sexual, both women and men's sexual health.
Oh, our time is up, but we can go on.
We'll go on.
Yes.
We'll just started, so.
Yes. Okay. So why do men experience erectile dysfunction?
That's a loaded topic. So, but you know, it's a lot of reasons. I'll try to keep it very simple so people can follow along. There's 4 main reasons. So if you think of erectile dysfunction, what is that essentially? That is not being able to achieve erection for intercourse, for penetration.
Yes.
So 4 main reasons. If you don't have blood going down to the penis, you're not going to have an erection. That's arterial. Artery is what brings blood flow down. Number 2, vein, venous reason. So if your vein leaks, the blood is just going to flow right out of the penis. So that's number 2. Number 3, nervous system. You need sensation. You need arousal.
Right.
So and number 4 is psychological issues. So if you had issue in the past, you're like, there's always, why have I had this problem? There's a very high level of anxiety that goes into performing, and so those are the 4 main issues. Okay,
that's good. So what treatment options are available to treat this concern?
So if you divide up those four things, then you can begin to have all kinds of classes of treatment. So, but mainly if you have fundamental ED, always worry about cardiovascular. We talked about the artery and vein, and just to highlight that, always make sure men get checked up for their heart disease. It goes hand in hand. So if you're having ED issues, worry about, make sure your primary doctor is checking you for heart problems. So what are the things we can do to treat ED? First of all the comorbidities that affect it needs to be treated. So if you have hypertension, diabetes, eating unhealthy, those things need to be treated. If your testosterone is very low, those need to be treated. And then we come down to the organic things, pharmacological things that we have available. There are medications that we can use for men, such that Viagra, Cialis, we call them PDE5 inhibitors. There's vacuum pump that people use in mechanical vacuum pump. There are medications you can instill right at the tip of the penis that delivers medicine and improves blood flow. And then we start getting to more aggressive things. There are injections you can inject into the side of the penis.
Like the Pshot?
We're going to get to the Pshot. So the Pshot is an exciting time. So there are actually medications that have components of Viagra in them that you can actually inject into the spongy tissues in the penis. And then the overall is people that have actually no blood flow sensation that do what we call implants, so penile prosthesis. I call it Air Jordans for the penis. But those get more invasive, right? So here comes the Pshot, which is a great option.
Yes, it is.
It's been around, they call it Pshot. So what is it? You know, it's not a magic shot, but it's a combination of using your own blood, spun down, retrieve platelets, which you know platelets have a lot of regenerative properties.
They really do.
And we inject it in a series of shots to the penis over time to help bring black blood flow.
Wow. Okay.
There's three properties to the Pshot, as you probably know. So it's regenerative, it brings in blood flow.
Yes.
It disrupts plaque issues. So people that have very thickened blood vessels and restricting blood flow down, it disrupts it.
Okay.
And it's been used for a lot of reasons, for a lot of indications for almost 20 years. And we are just catching on to it in sexual health and aesthetic practice. So I'm very excited about it.
Yes. So next question, where's the best place to get a Pshot treatment here in Nigeria?
Well, here in Nigeria, I couldn't tell you any place more. The only place, and I've been in this space for almost 3 years, the only place I know of now is just Flawless by Abby, Flawless by Abby here in Abuja. You have to come meet with your consultants so they can get a thorough evaluation. As you probably know, you have to pay to play. Nothing is for free in life. If you're having ED and it's affecting your quality of life and your relationship, this is where you have to come to. Flawless by Abby, they're well known for their Pshot. They have good results, and that's
right. That's right. So last question. What's your favorite activity to do outside of working? Doctors are always busy.
Oh, joy. Well, so I still have young kids, so my activities has changed over years. So I used to play football for a long time. I still have my football cleats in my car. But now I chase kids around. So taking the kids to swimming and parks and bicycling. We bicycle a lot. So those are
That's amazing. That's lovely.
Yes.
So that's it, folks. Thank you for
the rapid sequence.
Yes, thank you for the rapid sequence. That was not so rapid.
Yes.
So it was so amazing having Dr. Ojo here at the practice. We look forward to having you and your wife be here. Hopefully the next time you'll be in Nigeria.
She looks forward to coming to partner with you all. Again, the shout out to Flawless by Abby and here in Abuja, the one and only that we know of. And if you come across the pond to the US side of things, look us up at Climax Aesthetic Surgery in Virginia Beach.
Yes. Thank you guys. Bye.